We are Group 24. I am Carmen Richmond.
I'm Mohammed Zakir.
And I'm Isam Mutala.
The topic we are discussing is common problems in oral and dental health. We will be covering some frequently asked questions in the pharmacy and how to deal with them.
Frequently asked question number 1. What can I do about my toothache or sensitivity?
When it comes to toothache and tooth sensitivity, the first thing that you need to do as a pharmacist is establish whether your patient has tooth sensitivity or has a toothache. Tooth sensitivity is caused by the gradual exposure of the softer part of your tooth that lies under the enamel called dentine. This dentine has very sensitive nerve endings that are filled with fluid. Triggers such as eating or drinking hot or cold beverages or eating foods that are very sweet can cause this fluid to move and trigger a painful response. Most common causes of tooth sensitivity are brushing too hard, gum disease, teeth grinding, receding gums, and tooth whitening procedures. Toothache generally occurs in individual teeth, usually the molars. It is caused by inflammation of the central portion of the tooth called the pulp. Cavities, trauma, and infection are common culprits. So as we can see from the picture, this is the normal enamel that covers the tooth. With sensitivity, thinning of this enamel allows easier access from hot or cold beverages, causing the fluid-filled nerves to vibrate and send painful signals. When toothache occurs, the problem arises from penetration into the tooth from decay, causing inflammation of the pulp area. By asking your patient some simple probing questions, it may be possible to ascertain whether the problem is toothache or tooth sensitivity. To establish tooth sensitivity, you may ask questions such as, do you brush your teeth too often or too hard? Do you have bleeding gums? Have you had your teeth whitened? Or is the pain triggered by hot or cold foods or drinks? For toothache, you may ask questions such as whether the pain is persistent or whether it is isolated to one area. By asking these questions, you will be able to tell what your patient is suffering from, and that will enable you to advise your patient appropriately on what to do. If the person suffers from sensitive teeth, you can advise the patient to use a toothpaste specifically designed for sensitive teeth. Advise not to brush too hard. Fluoride-enriched products may also be recommended as they strengthen the enamel. If the patient grinds their teeth at night, they can wear a tooth guard at night. If the patient is suffering from toothache, it is important to explain to the patient that ignoring the problem may cause the infection to spread. If the patient is suffering from toothache, it is important to explain to the patient that ignoring the pain may cause the infection to spread into the bone and cause an abscess. In the meantime, you may dispense non-steroidal anti-inflammatory drugs and antibacterial mouthwash. However, it needs to be stressed that they need to go see a dentist for antibiotics and a concrete diagnosis.
Frequently asked question number 2. My dentures are hurting my gums and don't fit properly. What can I do about this?
Okay, so before we approach the question about dentures, what are dentures? Dentures or false teeth are removable replacements for missing teeth. There are two types of dentures, complete and partial dentures. So complete dentures are used when all the teeth are missing, and partial dentures are used when some of the teeth remain. Now, let us approach some common problems with dentures. Gum and mouth irritation, problems while eating and speaking, dentures that move around in your mouth, and mouth infections. So, firstly, to overcome these problems, make sure that the dentures fit. If the patient is complaining that their dentures move around or fall out, then they need to understand that they may need adjustment or replacement. It is important to tell your patients that do not attempt adjusting them by themselves. Explain to your patient that bones and gums change over time and this may be the cause. If you are certain that the dentures do fit but tend to come loose, an easy solution may be to recommend the use of an adhesive. This will help the dentures stay into place and make them feel more secure. However, it is important to explain that adhesives are not recommended to fix old or poorly fitting dentures. With regards to wearing dentures and speaking slowly. When a person first gets dentures, it may be troublesome to pronounce certain words. Assure your patient that they need to be patient and practice saying challenging words aloud and slowly. If your patient complains that the dentures move around when they laugh or smile, tell them to gently bite down and to swallow to put them back into place. With regards to eating and wearing dentures, if your patient has trouble eating while wearing their dentures, advise them on the following tips. Eat soft foods, take small bites, don't eat sticky foods, chew your food slowly, and while eating, use both sides of your mouth at the same time. Over time, your patient will become used to the dentures and eating will definitely become easier. Commonly caused mouth infections linked to wearing dentures are cheilitis. Now cheilitis is cracking in the corners of the mouth, and stomatitis, which is infections caused by yeast. Both of these problems can be prevented by proper dental hygiene. So some tips on hygiene with the dentures: handle with care and avoid dropping them. Dropping them causes cracking to the dentures. Brush and rinse them daily and clean with mild soaps and not using harsh abrasives. You should keep your dentures moist at all times when not wearing them, so this prevents them from losing shape and causing the teeth from getting loose.
Frequently asked question number 3. I think my breath is really bad. How can I stop my bad breath?
Bad breath, medicinally known as halitosis, can result from poor dental health and may be a sign of other health problems. It can also be made worse by the different types of food people eat. If a patient comes into the pharmacy complaining of bad breath, explain to them that basically all food eaten begins being broken down in the mouth. As foods are digested and absorbed into the bloodstream and eventually carried to the lungs, they are given off in the breath. Strong foods such as garlic and onions will not go away until all of it has passed through the body. Brushing the mouth can just help mask the odor. Patients need to understand if they don't brush their teeth daily and floss, food particles will remain in the mouth, and this promotes bacterial growth between the teeth as well as on the gums. Bacteria produces odors and this could cause bad breath. If a patient smokes, they need to understand that this also causes bad breath and inflammation of the gums, and we need to advise them to stop. Bad breath may be prevented by avoiding these causes. However, if the patient complains of persistent bad breath or a bad taste in their mouth, it might be a sign of gum disease. Gum disease is caused by the buildup of plaque in the teeth. If this is the cause, explain to them that this might result in damage to the gums as well as the jawbone. Other dental causes of bad breath include poorly fitting dental appliances, yeast infections, and dental cavities. A medical condition, dry mouth, can cause bad breath. Saliva is necessary to moisten the mouth, neutralize acids produced by plaque, and wash away dead cells from the mouth, including the tongue, gums, and cheek. If they're not removed, they will decompose and this can cause bad breath. You need to find out from your patient if they're on any medication which causes dry mouth, if they have salivary gland problems, or continuously breathe through their mouth. If your patient is aware of these causes, they may be more conscious of which may help prevent this common problem.
We can conclude that us as pharmacists are in a unique position to enhance oral health. This is because many people talk to and confide into their pharmacists nowadays. Oral health care can be easily received with patients coming to their pharmacy for their regular meds, and a standard of care can be established. There are many over-the-counter healthcare products that may be recommended to our patients to assist with dental health. We as pharmacists also need to know when to refer our patients. If there are any noticeable changes, such as unhealed lesions or, for example, loss of teeth, it is best to see a specialist such as a dentist. From myself and the pharmacist team, we thank you.